am Shalini Bharadwaj. You all are watching ITV Networks Medically Speaking. India is again facing COVID-19 crisis, and today we have with us on our panel to discuss about COVID surge, Dr. Rakesh Mishra, who is the director of CSIR-CCMB. We have with us Dr. Padma Srivastava, who is senior neurologist from All India Institute of Medical Sciences. Welcome to the panel, sir, ma'am. Welcome to Medically Speaking. My first question goes to Dr. Mishra. Sir, what explains sudden surge in COVID-19?
See, the most understandable reason is that lots of COVID infected people are around a small number 2-3 months back, and things were in control. But suddenly we started to, now I will not say suddenly, gradually we started to become careless, and we thought that we means most people, common people thought that Corona is now gone and we can resume normal life. And gradually over 2-3 months period, many activities happened, and we are seeing the consequence of those. And after a point when the number of cases increase, then it picks up. It's like a chain reaction. So for example, political activities, farmer protest, marriage parties, local trains, school opening, restaurant opening, bars open, malls open, and so all these things mean that lots of exposure to people, and these things have led to sudden increase. And once you have increase in large number for long period of time, that also means that more and more variants will emerge, because the only way variants emerge is when they are infect, in, occurring in large number of people.
Sir, especially if we talk about Punjab situation also, we can see a lot of people over there have been infected only because of the UK variant.
Yeah, so you can actually link that very nicely. If you see the data, the UK variant means these are the travelers initially who came from UK, and then they participated in some activity where large number of people came together, and then they went to smaller cities, towns, and villages, and they then started to spread. It is relatively more efficient in spreading, but the reason for spreading is only one, which is when people are not careful and infected people are in close proximity without protection to uninfected person who is also not protected. That's only way. It doesn't matter which variant it is.
Dr. Padma, ma'am, what you would like to say about sudden surge?
Again, as Professor Mishra said, it is not really sudden. Then, we've had some kind of a history. 100 years ago, there was a very similar pandemic. There was also a second wave, which was steeper and more worse, and then a third wave. And then probably then it just melted into the environment and continued to stay. So the same thing was repeated itself. And then we also had an experience of going through it a year. And also we've seen things happening in the Western world as well, how the waves have come. So what has happened now, as Professor Mishra said, are obviously the variants which have come. Nevertheless, the second is the fact that, there were a lot of these groups wherein there was a lot of, like, say, for example, in Mumbai, I've heard that, Dharavi and all those places where there was a lot of infection. And there were these high rises where the infection was not there. And now we have seen that is the high rises which are actually getting infected, because these are the groups who have not been exposed to the infection. And so then there is no immunity. And then there is an exposure to a variant which is far more infectious, coupled with the fact that there is a COVID inappropriate behavior for reasons more than one. There is a COVID fatigueness, and also the kind of confidence which is obviously not with any damn scientific evidence behind it, that one vaccine shot and all's well. So we have vaccine sayers on one side, or on the other side, with one shot, people have just gone ahead and thrown caution to the air. So therefore, the COVID inappropriate behavior, COVID fatigue, and then completely being, bereft of any thought to what is happening to the pandemic. And I won't say just India, even across the world, you're seeing this kind of a behavior in young people, etc., and all that. And then the vaccinations which are going on. Obviously, it is important to have a rollout in a systemized manner because we have to have a demand and a supply which have to be there. And all along, the task forces have been saying it that the rollout has to be systematized. Said that though, we also have a lot of young people out there who are not in this vaccine gambit, who are the ones who are really going about and are there everywhere. So probably now, since more vaccines are coming, the drive need to now include everybody who are there, along, so that probably, and I'm sure most countries are waking up to that as well. And again, juggling with this demand and supply so that the most important or the most relevant do get vaccinated. So I think it is the behavior known that historically we are going to hit waves and waves again. And when we were in the trough, we probably, should not get, sleeping. And I don't know, I'm not an expert, so I'm not going to comment on that. Number three is that the vaccination should now complete everybody who is going to be relevant to us, irrespective of, whether it was less than 45 or more than 45. And of course, the fact that, once vaccinated also you need to, because we're going on repeating the same thing over and over again, Shalini, but somewhere it is not hitting the spot, because even when they're opening up, people are not, coming to take those vaccines. And people want to get vaccinated, but they are in lines which are probably they're not in a system where they would want to get vaccinated. So lots of it's difficult task, I'm sure, for any admin to deal with this. And as a citizen, it is our responsibility to contribute to this mess, to it becomes less messier. We all have contributed, I think, to
Yes,
these waves.
of
Yeah.
course, ma'am. We have with us Dr. S.K. SARIN, who is a director of ILBS. Sir, the situation in India worsens. What are the steps now we all should take?
First, we have to accept that we have a difficult situation, and we are actually having more infections now than we anticipated, and this is likely to go and overshoot probably the last year's numbers. So first, we have to accept that we are down in the dumps, we are in trouble. And therefore, if we accept that, then certainly we have to manage at least this wave of severe infection and rapidly spreading infection. And then the second step would be, how do we prevent a subsequent wave and not let these waves keep on coming and keep on disturbing our economy and lives. So if we understand the reasons, as I think Dr. Mishra and Dr. Padma have already said, in my opinion, this was anticipated. Even in January, when the things opened up very rapidly, we had the first mutant coming. And the first mutant, the UK variant, had come, or at least was detected at that time. And from then, everyone knew that, like in UK, in 3 months, it would make up to the major proportion of people getting infected. So we are not doing as many sequencing as we should for the virus type, but it is anticipated that in few weeks, this may become a major, viral variant infecting Indians. Of course, other variants are there. So, and the virus has a life cycle of about 12 weeks to 16 weeks until the time it has a major mutation. So while they're occurring, we should be aware of mutants coming and infecting more and more population in different cities where it was not there. The second part, which I think has worried us, is we have opened almost all our transport, all our offices way back in January, thinking that the virus has gone away. And also the fact that we thought vaccine has come, and the day it has come, all of us are immunized. So those two things have probably helped the spread. The worry in our mind now is the number of deaths might pile up in about next 2 to 4 weeks time, when the infection gets deeper and more people get involved. I think the situation is difficult, but all of us have collective responsibility.
That's true, sir. Dr. Mishra, sir, how can we check such waves?
Check, you mean how to stop such waves?
How we can check such waves, sir? Earlier also you said that we should focus on genome sequencing. So how we can keep a check on such waves?
So the genome sequencing is just it opens you to the aspects of the virus, that what kind of changes it is acquiring, and if there is any particular area where the particular variant is increasing in number, so that might mean that it is more infectious, or it could also be that people have carrying that variant have participated in some super spread events, and it may not necessarily mean the virus is more infectious. Remember, uh, virus being little more infectious, less infectious is all right, but it is people who are taking it from one to other. No matter how infectious the virus is, if we are protected with mask properly and do social distancing, virus can do nothing to us. So we have to keep in mind that we are only generating the mutants by allowing the virus to go to large number of people, and mutation is a natural process of any life form. In this virus, as is expected, it is quite fast. So what it does is the genome sequencing keeps us aware of if a particular variant is emerging and spreading faster. So it is very important that we check it there, which means put more restrictions, more controls, traffic restriction, whatever is required, so that it doesn't spread all over the place. The other way of our utility of the variant is like UK variant. So we can by sequencing not only the signature of the UK variant, but other mutations that are associated with this. We can tell with the timeline how it has come, where all it has spread, and how it has gone to rest of Punjab. So this tells us the history of the infection. We can make a family tree of how it has originated. So it allows us to understand how the process is happening. And then genome sequence is also very important if we see more people dying or more severe infections. So we can check and see that, okay, if there's a variant which is causing this kind of problem. And so therefore we can take measure. So genome sequencing is a valuable information which gives us some hints at what might be happening. But the control of this is, even if we didn't know what variant it is, if we all took extreme care and behaved in a COVID appropriate manner, we would not be in this kind of situation.
Dr. Padma, ma'am, do you think a lockdown is one of the useful option which we have as of now?
So the lockdown, in its definition, may not be the kind of a lockdown which came in the early part of, the March 24th, in fact, to be exact, last year, because that was actually essential for us to get preparedness, because at that time we didn't have a single PPE, we didn't have nothing at all, no infrastructure. That kind of a thing I don't think we need right now, because the preparedness is there. But however, the movement of, as Professor Mishra said, the movement, as Professor SARIN also said, people's movement across the geographical areas, as well as their own movement in the sense, even in cities itself, going and doing things which probably prioritize those kind of a movements. You can't say, oh, I'm fatigued out, let me go to a restaurant and have fun. We've actually seen people going down, educated, highly aware people going for vacations, and going and traveling. So that kind of a situation probably will need a lockdown. So we've actually seen now the night curfews are predominantly, they're not restricting emergencies, but they would certainly restrict cinemas and malls and shopping sprees and restaurants. So again, you're prioritizing what is not relevant for day-to-day living. At the same time, you need to balance out the economy. And I think the basically, it's very easy for me to come and give sermons as to, oh, this has to be done. But I guess the administrations will need to balance out so many things. in the short run, in the long run, in such a situation, I believe short lockdowns, yes, and maybe, in a lockdown which pertains to certain aspects, not a complete 24/7 kind of a lockdown we've had before. I don't think that's going to answer the problem right now. But yes, the restrictions or sealing of certain borders and sealing of certain travel, and also certain aspects in day-to-day living which can be clamped down, those lockdowns probably would be required for a short interval, at least for the next 4 weeks, because this is really going to hit us. I mean, this is hitting us. Yeah.
Dr. Sarin, what you would like to suggest, sir?
Well, it's like a seat belt phenomena. As you sit in a car and you take a seat belt on you, you feel you are safe and you can drive faster. And then you have more accidents rather than less. So this is the same phenomena. The people, once they had possibility of getting a vaccine, they let go. The same thing also happens with lockdown. So once you finish a period of 2 weeks or 4 weeks of lockdown, you feel, oh, now the virus is gone. Now I'm okay. So they do double or triple activities of what they were doing earlier. So lockdown sometimes is not a very positive way of managing. It is, yes, as Dr. Padma says, preparedness for getting things in order, hospitals, ICU beds, drugs, and protocols, and healthcare workers. However, the testing and tracing, containing has to be as strict as possible, and especially with, as Dr. Mishra says, the variants that we are coming. So there is no question of a total lockdown which can be effective now. We have elections, we have Kumbh, we have all those big events where mass gatherings are occurring. You just cannot, live abnormally in a country as large as India. So let us accept that lockdown will have two kinds of preparedness. One is testing, tracing, and containment by the government, but lockdown has to be self-imposed. You have to see that you actually lock yourself down compared to others for transmission of the virus, because our salvation cannot be alone. Salvation will be together. If one dies, the other also can die. Therefore, we have to be sure that this is not done. And the virus is like, is like a villain. It will go away and then show again, go away and show again. So this has to continue and we have to survive. Now, coming to the two or three important parts about vaccination, we need to understand vaccination. We should have done maybe a little more faster. Going in hindsight, we could have probably, we have just done 7% of our population, which is much less. And I think at least the areas where the virus is spreading fast, like Maharashtra or maybe Karnataka or Delhi or wherever, I think age bar should be removed and everyone as fast as
Mhm.
possible
Mass
should
vaccination
certainly,
is required as of now, sir.
mass vaccination is required. But in the history of medicine, there has never been an occasion when the whole world has to be vaccinated, and that too fast enough. So there are challenges of getting the vaccine available, challenges of side effects, challenges of having people to vaccinate, and most importantly, people to accept the vaccine. All these are challenges. Having said that, through you, through the media, it is very important for us to communicate. All of us would like to communicate today. There are two types of vaccines available. One is your mask. Second is the available vaccine. And we have to employ both of them. Get your shot. Do not be hesitant to that, because there are three advantages of getting a vaccine. People say, कि साहब उसको वैक्सीन लगी थी, 2 शॉट लग गए, फिर भी इन्फेक्शन हो गया, क्या फायदा हुआ वैक्सीन का?
Right,
But to
agree.
them, it is very, very important to understand, आपने 2 शॉट लगाए, उसके बाद में you have got an infection. This infection is milder. This occurs
Severity
very
will
rarely.
reduce, sir.
Yeah, it will reduce your severity of disease and the severity or possibility of your transmitting the virus to others. So hence, one benefit of getting vaccine is, if at all you get an infection, the chances are 0.02 or even less, then your infection will be mild. Second, the advantage of getting a vaccine is that you will have antibodies which will at least last for 6 months to 1 year. So you can probably have a kind of a vaccine certificate, but 4 weeks after the second dose. But that does not make you leave all the COVID appropriate behavior. And the third advantage of vaccine possibly is that once you have a vaccine, you can become and work like a frontline worker. No doctor, nurse, healthcare worker should work if they have not received both doses of vaccines. In fact, if there is a possibility, there is a support, we should test the immunization, because vaccination is not equal to immunization. Immunization means you have good level, high level of protective antibodies. We haven't come to that, but in future we will need protective levels of antibodies to be determined. If there is a need, we need to give a booster dose for these people. This virus is going to stay, it's not going to go away. Maybe 2022, we have to see this virus and we have to live through mechanisms of containing it. Therefore, I'm telling you in little detail, vaccine has advantages. Take what you have today. Don't think this vaccine versus that vaccine. And if we are overcautious, this vaccine may have side effects. We may lose more lives. We may lose our life if we have been so cautious. So take whichever vaccine it is. They are safe. Millions have taken it. And healthcare workers, frontline workers, whoever has not taken, my urge is they must first take it up. The sick patients must take it up. And if vaccine is available and there is a possibility, we should vaccinate everybody as fast as possible above the age of 18 years.
That is very important, sir. Sir, Dr. Mishra, what message, sir, you would like to give?
I completely agree with Dr. SARIN and Dr. Padma that lockdown is not an answer. In fact, lockdown means we have failed. You can't keeping and the miseries that people have gone through, that was heartbreaking. We can't be. Uh, it looked like we are a primitive society. People are running around, and that's not acceptable, and that should not happen. That time lockdown was necessary because we needed to be prepared and so on. Now we are more than a year into this. I will say, like Dr. Sarin said, we have two vaccines. So first one is your mask. Like we come out of our house with our cap on, with our chashma, with shirt, pant, like that, mask should be part of our culture. Anybody not wearing the mask in the community should be looked down upon, should be politely uh, told that you are antisocial. In fact, and that is true also, because you, that means you are encouraging the virus to go through you to somebody else, or if you already have got your spreading. So this is really antisocial if somebody is not wearing mask and properly wearing mask. It's not hanging on your chin. It's not your beard that you need to protect. You need to protect to the mouth and nose, which is what I mean, if people can manage the mobile phone, smartphone, which is I find quite challenging to use all these WhatsApp. Mask wearing is not that kind of. It just shows arrogance or stupidity. I will say that hanging a mask is enough. So if we do that, and now we have compared to last year, now we have vaccine which everybody should take, and as we are, all of us are convinced that as fast as we can. Because that's the key thing: fast and large number. If we don't do fast enough, we don't do large number, that means virus still has its field and it will come back to haunt us again in different avatar. So it has to become part of our culture in 6 months at least, that everybody wears vaccine, and we avoid unnecessary gatherings is very, very important. It's looking at the rallies and kumbh and I mean something which is really avoidable. What phrase we have got to say to others that you wear mask, where there are thousands and thousands of people without mask and in full view of the people. So we have to be a little more strict. Maybe lockdown should be on the rallies and the religious activities so that people can carry on with the normal life. It is a matter of few months. We can then be, if we don't do this, then we are going to stretch already tired our healthcare system.
True.
Although we have more facilities, but people are the same. We have not double, tripled our healthcare worker strength. So how long we expect them to work day in and day out in these kind of conditions? So what I'm trying to say is that if we peaks keep going like this, the surge keeps going like this, there will be crowd in the hospital and we lose lots of life if we continue this way, which can be saved if we vaccinate large number and attack the virus by not letting it spread,
And
which is
quality
by
of healthcare
masking.
will also get affected, sir.
Yeah, of course, it will, and many things that we don't realize. Even that so many other patients they don't get admission who are need to be attended for something else. Lot of other vaccinations have to happen. All these things take heavy toll. So we have to minimize all that. We should be so very strict and tools we have. I mean, 6 months back, even I didn't believe that there will be a vaccine, but now it's something like amazing that so much of scientists have worked, the industry has worked, and our regulatory bodies have done fantastic to make vaccine available for us. Now we should use it. I don't know why half the capacity is used and of the I mean, we could probably vaccinate 40 lakh, 60 lakh in a day, but we're doing half of that. So I think that should go on war footing. That's what we should focus and make mask wearing as a culture. And somebody who's not doing is uncivilized and should be educated. And we do these two things, we can still come out without much of loss of life. Otherwise, we are going in very bad direction.
Dr. Padma, protocol fatigue is already there, and this time more and more youngsters are getting infected. What you would like to say?
So therefore, the same thing that we would reiterate, one is that we have one weapon with us, which is vaccine. So vaccine everybody. In fact, they say now probably is a time to everybody after the age of 18 years. And there's a lot of data even coming now that vaccines are also probably okay for children. So now we have more varieties of vaccines. So probably the demand and the supply would be a good ratio. Go ahead, ASAP, vaccinate everybody. We are a democratic society. So we would always say voluntary, but sometimes I believe that it needs to be mandatory. Also, in certain sectors, in fact, it needs to be mandatory and not just tell them, please voluntarily come and take it. And I think that is because of that, again, the balance of some people coming up and saying that there are side effects and a lot of publications on, what may happen once somebody's taken a vaccine. All that is a learning curve. And as a lot of literature and a lot of experiences gathered now, I think there are sectors where it has to be, especially in the healthcare sector, it needs to be mandatory. Please take it. And as you say that there's a lot which is beyond COVID. We had a pre-COVID and a post-COVID era. Where this is like BC, and I mean, our BCs are gone now. There's nothing like a BC and AD anymore. Therefore, in this kind of a situation, beyond COVID, as Professor Mishra said, there's a lot of non-COVID health problems which are hitting the roof. And somewhere there's going to be an avalanche of those issues which will really be, it may affect all of us. And so it is, no one is immune to this aspect at all. To contain that, we need to contain COVID. To contain COVID, all of us need to be healthy enough to go about our normal lives. And for that, there are only two things. One is vaccine, the other is your mask and COVID appropriate behavior. I certainly would say the physical distancing part is not working out with elections and the rallies and whatever it is. So that is a practical aspect of it, but you can still wear your mask when you go out and leave out all non-prioritized issues in one's life. It is not just you, me, or everybody. It is actually a society which is there. Again, I'm coming back. My last statement, Shalini, is each one of us as responsible citizens have a part to play. We can't blame the government, blame another task force, blame the scientists, blame political parties, blame the rallies, blame. No, it is actually, it's your own responsibility, which all of us contribute our own little bit. We can win this war.
Thank you, all of you, Dr. Padma, Dr. Rakesh Mishra, Dr. SARIN, for sharing such an important information with us on Medically Speaking. Thank you so much.
Thank you.